Good afternoon, everyone. At the outset, I would like to thank organizing committee and the Dr. Rishi Prashar for giving me an opportunity to come over here, be with you. I'm going to talk about today evidence and my views on glutathione and tranexamic acid in melasma. So before initiating my talk, there's something like the most precious slide of my presentation is live for a cause. This is the only one thing which is going to matter in the end, and keep spreading love, warmth, and happiness around you. So coming back to work, so that's evidence of glutathione in melasma. As such, there is no evidence exist for glutathione in melasma whatsoever is available on the internet. And whatever literature says, it's more of skin lightening than melasma. I'm going to talk about that in my presentation. So glutathione, most commonly used systemic skin whitening agent, though there is no evidence exist in the literature to support this. Glutathione is available in both reduced and oxidized form. It has been commonly used to combat the neuro and nephrotoxicity associated with cisplatin chemotherapy, and this is the only one FDA-approved indication of intravenous glutathione. The role as a skin whitening agent was an accident discovery, which was found when it was used in very high doses for other problems. So let's have a crisp of melanogenesis. Whatsoever is going to inhibit tyrosinase and make a shift from eumelanin pathway to pheomelanin pathway, it's going to work for skin lightening, and glutathione does the both. The major problem with oral glutathione is that it gets hydrolyzed easily in the intestine by hepatic gamma-glutamyl transferase, which results in reducing bioavailability of the drug. That's the reason it is often combined with vitamin C, E, alpha-lipoic acid, acetylcysteine, grapeseed extract, etc. to increase efficacy and bioavailability. The dosage and the duration of oral glutathione has not yet been standardized, and it is over-the-counter available in the United States, Philippines, Japan, and in India as well. The recommended dose is 20 to 40 milligrams, which is 1 to 2 grams in divided doses every day for 3 months to 12 months. After attaining the desired result, a maintenance dose of 500 milligrams per day is advised. Now here comes the question. Till what time would you like to give glutathione to your patient? We actually want to lighten the skin, which is a normal, physiological, and genetical driven phenomena. It is just like working petrol in the car tank. You keep on refilling your petrol, the car works for you. So the question remains unanswered, and it is not justifiable to put your patient on glutathione for the rest of his life. Most of the studies of oral glutathione supplementation has a negligible effect on raising plasma levels in humans. There are only 2 studies by Ritchie and Park which says there was raised plasma level of glutathione after the oral intake, but mind you, both these studies were pharmaceutical sponsored. There are only 2 studies that evaluated the efficacy of oral glutathione as a skin lightening agent. This one study which was done in Thai medical students, where 500 milligrams was given in 2 divided doses. At 4 weeks, the melanin synthesis decreased. The limitation of this study was short study period, lack of follow-up, and lack of measurement of serum glutathione levels. There was another interesting study which was done in Filipino women, where they used the buccal root by giving oral lozenges containing glutathione. It showed significant decrease in melanin index. It was more effective than oral because it bypasses the GI route. Skin lightening effect on both exposed and unexposed areas were seen in both the studies. There's always mixed school of thought, some people say the topical glutathione works, some people say that it doesn't work, but a randomized double-blind controlled trial using 2% oxidized form of glutathione showed significant reduction in melanin index, and there were no adverse side effects reported. Recently, a glutathione-based chemical peel has been launched, although evidence of efficacy is lacking. This is the most important slide. I want you to have attention, please. There is not even a single clinical trial evaluating its efficacy as intravenous mode in the skin lightening exists in the literature. It is recommended in the dose of 600 to 1200 milligrams for skin lightening. to be injected once or twice weekly. In many studies where it is given intramuscular for male infertility and to enhance insulin secretion, it did not report any significant adverse effect. But there is a long list of adverse effects exist which has been reported by FDA of Philippines, which includes SJS and TEN as well. Mind you, it is not approved yet by US FDA as an intravenous skin lightening agent, and there is a public warning which has been issued by Philippines FDA as well. Not much published literature on the efficacy and methodology of using glutathione solution as mesotherapy exists, widely practiced by dermatology for treatment of melasma and other melanoses alone or in combination with ascorbic acid, vitamin E and tranexamic acid. The results are claimed to be very good. Use of glutathione as mesotherapy needs to be more evidence. So let's have a look on tranexamic acid in melasma now. As we all know that it is a plasmin inhibitor. Plasmin enhances the intracellular release of arachidonic acid and elevates alpha MSH as well, which leads to increased melanin synthesis, and tranexamic acid, by way of its anti-plasmin activity, depletes the keratinocyte pool of arachidonic acid, thus decreasing the pigmentation. There is enough data available as evidence for tranexamic acid as oral agent in melasma. It's given 250 milligrams twice a day for at least 3 months for the treatment of melasma. Used as adjunct, helps in a rapid and sustained improvement, not safe to use for a long duration because of side effects, and contraindicated in patients with defective color vision, active intravascular clotting, and hypersensitivity. A survey, it's a review on oral use of tranexamic acid, concluded tranexamic acid as an adjuvant in the treatment of melasma, which can be successfully used. There is not much there's always a question of debate that whether to use topical tranexamic acid or not. A randomized double-blind controlled trial using topical 5% tranexamic acid in melasma concluded that there was no significant improvement compared to placebo. Liposomal preparation are the best and can be used in concentration of 2 to 5% in cream form also. It is even being promoted as intravenous injection for skin whitening at a dose of 500 milligrams every week, followed by maintenance. There is no scientific data exist to support this also. Most of the scientific evidence is pertaining to the use of tranexamic acid microinjections in melasma. One study where it was given weekly for 12 weeks in dose of 4 milligrams per ml. Note that there were 12 sessions were given in 12 weeks. There was a significant decrease in massive from the baseline, which was observed later. Another study where tranexamic acid microinjections was found to be more effective than microneedling with tranexamic acid solution. There's something which is very interesting. I would like to share it with you. This is Cyklokapron, which is available in the market. This is a commercial preparation, 500 milligrams per 5 ml, and injection vitamin C, which is ascorbic acid. What I prefer using, both of them, 0.5 ml, diluted in 1:1 concentration and injected in a superficial dermis. This is a patient which I know her past more than 5 years, tried everything, didn't work. So in her, I gave intradermal injections of these two mixed together. You have to take insulin syringe and go very slowly and just touch the skin, beveled up. As it starts moving inside the skin, start injecting. You will see the blanching of the skin, and the skin is going to turn white at that point of time. So keep injecting slowly. It is going to go all the way in the superficial dermis and even upper part of dermis and epidermis, lower part of epidermis as well. So I'm going to share with you something which patient has noticed in next 7 days in her own words. Now you can see in the day 1 after injection, so you can see the swelling there and little pigmentation. So patient says, is this how the skin should be? Day 2, it is much better today, we'll keep you posted. Day 3, a lot better, can see the scabs, which too fall soon. Now you see at the day 7 after injection, it is so gratifying to see her happy. She says, check this out, it is fantastic, skin almost 70% clearer within a week. Day 7 after injection, the final look after the makeup. So it is something like which is really like gratifying for any doctor also. We have never observed such change in any of our melasma patients in just 7 days with only single session of that treatment. I called her yesterday to ask how she's doing after 3 months of therapy. She has stopped everything she has not been using. This is what she says, the treatment done in Feb. Very happy with the results, as my sun exposure is about 6 hours a day and my son plays golf. And I drive a lot. Before this, I had got different types of treatments, which you can see, which last only for a couple of weeks, which has been troubling her. So she was very jubilant and very happy after the treatment and never came back to me. It's been 3 months now. There's another patient, you can see day 7 after the injection. She says it is quite better.
Anu, you need to conclude.
Yes, sir. Another 1 minute, sir. So my views, melasma is hormonal, can be controlled, cannot be cured. We should strictly discourage the use of intravenous glutathione and tranexamic acid as skin lightening agents because of the side effect, and there is no FDA approval and no evidence to support this. Both can be used as an adjuvant to primary treatment, but not primary treatment. Oral glutathione and tranexamic acid is preferred on topical preparation because of enough evidence in the literature. Intradermal injections can be used in stubborn cases of melasma not responding to topical treatment or peels, so it is not your first-line treatment. It is painful and tenderness after that. Need studies using varying concentration of intradermal tranexamic acid with or without glutathione, and even comparing both. Thank you very much for your patient hearing.
Any questions? Yeah, Dr. Ganju.
Behind banning the combination of proanthocyanidin and tranexamic acid is? In the long list of banned combinations recently, they have put this also into one of them,
Yes,
as
sir.
one of them.
Yes, sir.
What's the idea of?
Yes, sir, they did, but like I don't not have any clue about that actually. So anybody else who can
It's
answer
the policy, the fixed dose wide combinations.
I have a question. I don't have an answer to that. Sir, what effect of the drug glutathione, vitamin C, or tranexamic acid mesotherapy do you attribute for the immediate effect that you achieve?
Well, like, I mean, if you ask me, treating lichen planus hypertrophicus with topical steroid or intralesional steroid, it does make sense. Like when we give just one injection of intralesional steroid, it works wonder in 7 days. So it is something like you are actually hitting the heart of the lesion with intralesional mesotherapy. Now you have to have a control on your hand. Either you can go very superficial or you can go deeper in the dermis. That's how I feel like targeting the lesion directly at the same point makes sense.
But how does the mechanisms of the drugs suggest they probably act on a long-term basis? How do they create such magnificent results immediately?
I don't know in her. See, like, I mean, if I would have to ask somebody, I'll tell, see, I cannot cure your melasma. It's just like diabetes to me. I'm giving you treatment. I can control it. If it bounces back, if you stop the treatment, it's going to bounce back. In her case, it did not, but I don't know. I cannot give you explanation why it was. But yes, it's like something which is important to mention over here.
Thank you.
Yeah.
I think the results that you shown were really remarkable. The injectable ones which has made difference over such a short period of time, and even if it is lasted for 3 months, which is good enough.
And with such a patient, I know her that she will never apply anything on her face. Yeah.
All right. Thank you.